I'm Cami, and this is my articulatory model. It is made of Play-Doh, clay, and plaster from a bite mold. First, we have the mandible, which is the lower jaw. It houses the lower teeth and forms the points of attachment for most of the tongue. The mandible moves to change the way sound resonates within the oral cavity. Posterior to the oral cavity is the pharyngeal cavity. Its posterior border is the posterior pharyngeal wall, shown here in purple. The pharyngeal cavity is broken down into three parts. Here is the nasopharynx. It begins inferiorly at the level of the soft palate and anteriorly at the level of the posterior nares. The dark blue shows the extension of the nasal cavity into the nasopharynx. Next is the oropharynx. It begins superiorly at the soft palate and inferiorly at the hyoid bone. Next is the laryngopharynx, which extends from the hyoid bone to the esophageal opening, not shown in this model. Here in pink are the lips. They are made of muscle, tissue, and fat. The landmarks of the lips include Cupid's bow on the upper lip, the philtrum bilaterally with philtral ridges, and the columella at the anterior nose. Important functions of the lips include closing the oral cavity and producing bilabial speech sounds. The inner surface of the upper lip attaches to the maxilla at the midline of the alveolar region via the labial frenulum. The maxilla, shown here, also houses the upper teeth. Just behind the central incisors lies the alveolar ridge. Posterior to the alveolar ridge lies the hard palate, and posterior to the hard palate lies the soft palate, also known as the velum. In blue is the uvula, the only intrinsic muscle of the soft palate. Now I'll discuss the teeth. They sit in spaces called alveoli, in the upper jaw and lower jaw. There are a total of 32 teeth in the adult mouth, 16 upper and 16 lower. They consist bilaterally of a central incisor, a lateral incisor, a cuspid, first and second bicuspids, first and second molars, also a third molar known as the wisdom tooth, which is not shown in this model. The tongue, in red, is housed within the oral cavity. It has an attachment to the floor of the mouth centrally via the lingual frenulum and attaches to the root at the hyoid bone, extending into the pharynx. The tongue is the most important articulator. It has a tip, blade, dorsum, and root, also a body. The tongue changes the space within the oral cavity, constricting airflow and stopping airflow to produce the sounds of speech. Speech sounds are characterized by place, manner, and voicing. I'll focus on place of production from anterior to posterior for this presentation. Place of production includes the tongue and its various contacts with the other articulators, with the exception of bilabials and labiodentals. The bilabial sounds are produced using the lips. Examples are P and B. Labiodental sounds use the teeth and the lips. Examples are F and V. Lingual dental sounds are produced using the teeth and tongue. Examples include the voiced and voiceless TH. Lingual alveolar sounds are produced using the tongue tip and the alveolar ridge. Some examples include D, T, S, and Z. Post-alveolar sounds are produced using the tongue and anterior hard palate. Examples include sh and zh sounds. Velars are produced using the back of the tongue and the velum. Examples include K, G, and ing. This concludes my articulatory system presentation. Thanks for watching.